We are honored to have a world-renowned cancer specialist here with us today, Dr. Mark Rosenberg. Dr. Mark Rosenberg, thank you so much for giving us the time. We know that you're world-renowned, you study all over the place. You're going to tell us better than I could tell the audience what you're all about. Can you just take a minute to tell us a brief synopsis of your medical history?
So my background is interesting and took an interesting turn quite a while ago. My board certification is in emergency medicine, so I ran many emergency departments. And while I was running an emergency department, my own mother walked in complaining of chest pain approximately 15 years ago. And unfortunately, I diagnosed her with metastatic lung cancer to liver, spleen, both adrenal glands, and left hip. Now, at the time, I didn't know anything about cancer other than the emergency management of a crisis. So I took my mother to two very well-renowned cancer centers, and that's where they explained to me that we have improved survival for most solid tumors by about 2 months with the standard of care therapy. So I didn't sleep for about 3 weeks, and I hit the internet big time, and I read all I could, and I started studying cancer. Long story short, my mother refused chemotherapy, and they had told her that if she used chemotherapy, she would probably live 6 months, no chemotherapy, maybe 4 months. She ended up not taking chemotherapy, and she lived 11 months. But I ended up becoming a cancer scientist, meaning I did some in vitro studies, and then I became the program director for the only Integrative Cancer Fellowship in the United States. And then I started a pharmaceutical company. And so my team and I developed a drug that targets cancer stem cells, as well as many other drugs that work through different mechanisms to minimize cancer resistance. So now I'm involved, of course, with the development of cancer drugs, as well as doing a lot of teaching and still treating patients through an integrative fashion. And when I say integrative, it means using every substance that works, regardless of whether the FDA classifies it as a drug or a supplement. That's me in a nutshell.
Wow, that's an incredible resume. So, in a nutshell, you are a world-renowned doctor who's specialized in cancer. You've taught around the world. You've even developed cancer-fighting medicine yourself. So we couldn't find a better source for any kind of health issue or information than you. So thank you again for being our doctor today. Let's get into some of the CBD questions real quick. What is CBD oil?
So cannabidiol or CBD is very interesting, and as I'm sure everybody out there knows, the cannabis plant is very, very interesting. And unfortunately, only in the very recent times is it getting the attention that it deserves.
A doctor like you that teaches other doctors, that makes innovative moves and really trying to fight stuff like cancer. Let's get into that a little bit. Something that in your infinite knowledge in medicine and health, something that you're really passionate about. One subplot of your knowledge that's really got you on fire, and that's the cancer research. So would you recommend CBD for preventing cancer?
I cannot say that. So I don't have the data. I try to live by data. I don't have the data to say that CBD will prevent cancer. And so I could never tell a patient, I recommend you take CBD to prevent cancer.
How about with helping with cancer symptoms?
And we're using it already. Many patients are either being told by their doctors to get on CBD for their symptoms, such as cancer cachexia, which means wasting, weight loss, for nausea, for anxiety. And the problem is most of the medical professionals are not educated adequately on the cannabinoids, and so many patients are just taking it into their own hands, which is okay too, because as I said, as long as it will do no harm, it's okay. So I do recommend it to patients, and many patients are taking it on their own.
And you would also recommend it for like cancer treatment side effects, like chemo and stuff like that, like you mentioned.
Absolutely.
Nausea and...
Absolutely.
Okay, so in the U.S., most of the reports that I read as far as research for CBD is mostly done in test tube and with animals. But I recently read that Israel is a little bit further, maybe more than a little bit further ahead of us in the research. What do you know about? What can you say
You're
about
correct.
that?
So Israel, I think, has been certainly from what I've read, Israel has been leading the field on a lot of cannabinoid research. Now, having said that, there is I mentioned earlier, or referred to earlier, a London-based public company that their whole platform is developing cannabinoid derivatives for treating diseases, including cancer. So they are obviously a major player in the game, but you're absolutely correct that Israel has been, leading the field on this.
This will be a fun little silly question for you. Here's one of the studies I read, an American-based research study, 20 mice. When they treated them with the CBD, the spread of the aggressive breast cancer that the mice had stopped. What are your thoughts on that? I mean, obviously, like you said, more research needs to be done, but what does that tell someone like you?
Well, it tells me that it has potential, but we always have to be, we have to calm down our excitement because, sometimes when I lecture, I will speak to the physicians and say, we have so many times cured cancer in mice, but how often does that translate to humans? And to be honest, our models for studying cancer in animals and mice is not adequate. And so we should all be clear on this. If we can very often cure cancer in mice, but it doesn't translate to humans, we have to question our models. So the models are not wonderful. So having said that, when it does work on mice, it certainly stimulates cautious optimism.
Another thing I read into too in trying to prepare myself for this interview was anti-tumor effects for CBD use. It's demonstrated anti-tumor effects, again, this is in animals, but preventing the spread of breast cancer, prostate, brain, colon, and lung cancer.
Sure.
What can we get excited about and hope for in the future of what CBD can do in anti-tumor effects?
So, since I have learned a little bit about the pharmaceutical arena, now that I'm jumping into that arena, this is going to require funding. Now, in order to get funding, you have to have really a patentable product. And so what I foresee happening is that likely CBD may be modified somewhat or attached to another molecule, somehow altered so a composition patent can be obtained. Because once you get a composition patent, there's a chance you can make money and at least not lose all the money that you do on a clinical trial. But I absolutely see that coming down the pike because we have enough in vitro and animal data to suggest that CBD has anti-cancer properties. So I do see it coming down the pike.
Now, when you talk about a patent, you talk about a strong CBD that's approved by all the proper sources. Would you say that would be a water soluble CBD versus a regular CBD, or?
Well, so I'll tell you, my recommendation when someone is just taking an oral CBD product now is to get a water soluble product, and that's going to be the most bioavailable. When we're talking in the future with making a pharmaceutical product, we'll want to do even better than that. For example, putting it in some nanoparticle with some polymer, something to go above and beyond what we can do by simply making it water soluble. But with regards to what we have available now, yes, to increase the bioavailability, I would want a water soluble form of CBD.
All day, every day, from where we're at right now.
Absolutely.
That's the one. That trumps just regular CBD that's not water soluble.